Are you frustrated in your current state of ACL reconstruction rehab? Or are you going to have ACL surgery and you're looking for a physical therapist? This is a video for you. We're going to break down why it's important to find the right physical therapist and some of the questions you need to be asking him or her to make sure they're the right fit for you. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. Finding the right physical therapist is almost as important, I would say, as finding the right surgeon. The reason I say that is the surgeon's gonna do the job, but then it's your job with the physical therapist to get ready to get back to the activity that you wanna get back to, if either that's sports or just everyday activity. So you're gonna have this whole relationship and you're gonna be during this entire time and they're gonna be guiding you throughout this process to make sure you get back to your sport or activity that you want. So finding the right physical therapist is crucial in making sure you have the outcome that you desire at the end of this rehab. So ideally, you want to find the right physical therapist before you even have surgery during the prehab phase. But it's not too late. You could always switch physical therapists. We see that all the time. We have people come in from their previous therapist or their previous treatment plan because they're frustrated. So it's never too late. But before you start making any switches or before you plan to have surgery, you got to start with your own goal setting. You want to ask yourself why you're having this surgery, because the surgery is a long process. We're looking at 9 to 12 months recovery fully to go back to the majority of your sports. But you want to ask yourself, why are you having this surgery? What do you want to get back to? Do you want to just get back to normal everyday functional activities, such as going back to work or just going down the stairs pain-free or just running, maybe some CrossFit? Or do you want to go back to your sports, playing basketball, volleyball, soccer, football? Those are the questions you want to ask yourself, because that is going to set you up for goal setting when you talk to your physical therapist, because there's different aspects. So if you want to just go back to your everyday activity, just simple, you might be okay with going with any kind of physical therapist. They might get you where you want to get. But if you want to get back to your specific sport of choice, that's when we really have to go dig in deep and find the right physical therapist for you. All right, guys, now that you've found out what your goal is of, like, let's say going back to sport or just going back to everyday activity, now it's your time to start interviewing physical therapists to make sure they have the same philosophy of yours. So when you want to talk to these physical therapists, you want to find out, one, what's their experience with ACLs? So if you see someone that just graduated that hasn't seen that many ACLs, that has to play a role in someone that's seen several ACLs and has a history of, like, hey, these are some of the things that worked with the past. So that's one big thing that you want to look at. Another one is, and I think this is a really big one, is the whole treatment philosophy based on your goals. So if they have a different philosophy and you, let's say, don't want to get back to sport and they want to push you to get back to sport, maybe that's not the right fit. So you guys have to both align in philosophy of treating and your way to get back to sport. So meaning you want to make sure they're aligned with what you want to do and you guys have a plan set up. And like, hey, this is how you're gonna get there. And they map it. It's like a roadmap before you even have surgery or at the first day of your evaluation. That way you know, what are my goals? What are my stages that I need to hit to get back to the goals that I've set with myself and the physical therapist? All right, guys, now that you've found the right physical therapist or right in that cusp between choosing one versus the other, another big thing that I usually tell people is you wanna look at the environment or the facility. So you wanna make sure if you're gonna go back to sport, you want to make sure they have weights, they have different equipment, because if you go into a clinic or a studio or a gym and they only have bands, that's not going to be enough for you to get back to sport. You're going to have some space to work on some movement, also some space to lift some weights, some leg exercises. So you really got to make sure the facility has the right tools for you and your physical therapist, especially if you want to get back to sport. If you want to just get back to your normal everyday activity, it's okay with limited equipment. But most of the time, you're gonna still need some weights, some different levels of resistance. So that's a big component when choosing the right physical therapist, finding out if their facility meets the requirements of getting back to sports. All right, guys, I just wanna summarize what we talked about right now. So when we're looking for the right physical therapist, first you gotta find out why you're gonna have surgery and what your goal is after surgery. Once you have that, you're gonna start interviewing physical therapists. Big thing you wanna do is you wanna make sure they have good experience with ACLs. They've worked, they're just not straight after graduation. They have experience, they know what you want to get into, and they also align with what your goals are. So if you want to get back to sport, they can help you there. If you want to just get back to normal everyday activity, they can also help you there. But you guys both have to be aligned with the same goals. The other one is the environment. Make sure they have the right facility, they have the weights, they have the space, because you're gonna have to do some movement and you're gonna have to do some leg weightlifting exercises. So the reason why we talk about this is we see this all the time. We have clients, we've worked with over hundreds of ACL clients, and a lot of them come frustrated and have issues during the rehab. And we always kind of talk to them, and we also screen people before they work with us, and we tell them our treatment philosophy. And our goals are, like we mentioned, we want to make sure we want to get back to the sports of your choice. We work a lot with basketball athletes, but we also work with all lower extremity athletes like soccer, football, volleyball. And the big things is we create this roadmap for them. So we create stages so they know exactly where they need to be based on not timeline, but stages. Hey, can you do this? Can you do that? And those are the stages that are going to help motivate them and get them to the next level. If you guys want to work with us, send us an email. We work with people online and also in Southern California, Los Angeles area, and Orange County area. And if you guys have any questions regarding the rehab process, comment below. Or if you guys want us to shoot a video regarding a different topic on ACL, comment below on that. We'll also try to shoot a video. Hit the share button with friends and family, like button, and we are the Basketball Doctors. Let's ball for life.